Psyche Truth. Life, wisdom.
Hi everybody, this is Gregory Gorey with Bodywork Masters, and today we are going to be looking at how to treat the shoulder using some Russian sports massage. This is going to be more of a demonstration about skin rolling. The main concept is that you can have nerve innervation problems, and one of the first steps to addressing that is actually to follow the nerves as they exit out the neck and down into the shoulder. You can do this with cups, and I've done a past video about how to do skin rolling type of activity with cups, but we're going to demonstrate it manually today. So the first thing we're going to do is I'm just going to come up into the neck and see if I feel any major subluxations, and a little bit right there, but it's nothing major. And so what we're going to do is we're just going to start right into the skin rolling. So this might be a little uncomfortable, but it shouldn't hurt. Okay, so we're actually just picking up the tissue and just pulling it off. And the nerves that innervate the shoulder and the lower arm actually come out of a big bundle here and cross underneath the clavicle. So we want to make sure that there are no restrictions right through the clavicle. Is that okay? Is that pressure too much? Okay. And we also want to see if there's any restrictions here at the, underneath the subclavius. So I'm going to shorten that muscle by, let me have this hand please. We're going to take it across the body. That's going to shorten this. And we're going to shorten the muscle, come in with my fingers and do a little pincer grip underneath the clavicle. And remember, this is a kind of a different concept, that rather than me trying to go in and do deep tissue work and really addressing the muscle, I'm actually looking more at the superficial fascia and any restrictions that it might be putting on the nerve bundles. Similar thing, I'm going to turn her head, and I'm going to be pulling all of the tissue lateral to the lamina groove here. So I'm going to take my hand, I'm going to come right up to the spinous process, hook into that tissue, and pull it off. So I'm turning the head, my hand is right on the edge of the lamina groove, and I'm pulling in that direction. Tender spot right there. This isn't the most like feel-good massage technique. In fact, some people, if they have really tight fascia or skin complex, it's real difficult to get any kind of separation like we're getting here. So just work at the level that your client is comfortable. It doesn't have to feel good necessarily to have a therapeutic effect, but it shouldn't feel bad. You shouldn't see them wincing. Alright, so I'm going to adjust my chair here so that I can get around to the other side, and we're going to treat the deltoid and down into the arm. So it's the same sort of thing, just taking and just a little pincer grip and creating a little space in between those layers. It's kind of a shotgun approach to seeing if there are any nerve restrictions that are inhibiting the muscles that support the shoulder. You can also shorten the muscle, which will help create a little space. You can also take two hands and just bring the skin together. This is really more skin rolling. It's not deep muscle work. Also coming bicep inserts deep here. We want to make sure that that's happy and healthy. So if you're doing this at home and you're working on clients, or you just are working on your spouse, this is kind of the precursor to the treatment. So like I said earlier, it's kind of a shotgun approach to make sure that the nerves are firing, and then you can follow it up with your deeper shoulder work and actually get into the muscles and start treating them. With the shoulder injuries, you pretty much always want to release the pec minor. The pec minor rolls the shoulder forward, and that's a real common problem in our world today. It's the rounded shoulders. So we're going to just come in. We're going to have the first head of the pec minor, second head, and the third head. You can make that even more powerful by activating the muscle, getting the muscle spindles fired. So let me have you roll your shoulder forward into my hand. and relax, and then it's a little stretch back, but now those muscles that just fired go into an automatic relax mode after they become activated, and you can get in a little deeper into that pec minor. So we've done the front line up through the neck. We still want to do some skin rolling and the lower trapezius here and the rear delt. So let's go ahead and have you turn over. Alright, so for demonstration purposes we had her turn over, and we're actually going to work on the backside of the other shoulder. But it's the same basic concept that we want to make sure, coming along and just lifting and separating the skin off of those other layers underneath it. We can come all the way to the spine, do some skin rolling along these lower trapezius attachments. Lower trapezius is a major scapula stabilizer. Lifting and separating all of these tissues off. Into the lat a little bit. You might have to worry about ticklishness with some people working in this area, but she doesn't seem to have a problem. Or at least I can't see her face to know if she has a problem with it, but she's not jumping. Also put the hand behind the back. This hand comes under to create even more space. Really work to separate that off. While I'm here, I'll go ahead and reach underneath and treat the subscap a little bit. Feels like it's got a little bit of a spasm right there. And because we are dealing with the shoulder, another muscle that attaches up into there is the latissimus dorsi, so you can actually take the skin rolling and make your way down all the way into the thoracolumbar fascia. Thoracolumbar. There! Fifth time the charm. Okay, it's coming up. And here we start getting, it's a little more difficult. She's a little more, is that a little more tender there? Yeah. So I could tell that the amount of resistance here I'm having to grab bigger handfuls rather than here. So this is an area that we want to spend a couple of minutes on. You can also do this with lotion, where it becomes much more of this sort of technique with the lotion. And there's nothing wrong with it. I oftentimes will work without lotion just so I can get a better grip. Alright, so we've released all of this area. We can also do a little skin rolling upper trapezius here. And into the rear delt. And into the tricep. And she just squirmed a little bit, so I'm going to... That feels so good. Oh, I thought you were squirming with discomfort. It was a squirm of delight. All right, well, that's basic skin rolling for the shoulder. We've got, if you have shoulder injuries or want to learn more about shoulder injuries, there are a couple of other videos about different styles of work that can be applied to the shoulder. Thanks for checking us out. Don't forget to like and subscribe, and we'll see you next time.